Hi everybody, my name is Megan. I'm one of the nurse practitioners at LH Spa and Rejuvenation, and I'm here to do an unboxing of the mail order pharmacy process that we have started with our semaglutide. When you receive an email from FedEx, you will receive your medication within 24 hours. This is what you'll receive in the mail. Please make sure that after you receive your shipment, you place it in the fridge within a few hours or as soon as possible to ensure that the medication stays cold. I'm going to review what you're going to receive in your shipment when you receive it from FedEx. It's going to come in an envelope that looks like this, and it's going to be HIPAA compliant with no indication of what's inside the package. For each 12-week shipment, you will receive one box for every 4 shots. So in this shipment, this would be a 12-week shipment. Your vial will come in a box with your name and all the dosing information on the label from the pharmacy. This is what a vial looks like. Vials come in different sizes based off of the dosing that your practitioner decides for you. You will receive the package insert from the pharmacy, as well as a vial. Each vial is customized based off of the dosing regimen that we set forward for you, which is why it's extremely important to make contact with us on a 4-week basis to discuss your month ahead. When we write your prescription, we are going to make the assumption you are going to follow a dosing protocol, but we will allow for wiggle room to titrate up, titrate down, or stay the same based on your symptoms and your weight loss goals. We're going to go over how to use the syringes. In your shipment, you're going to receive a package of syringes directly from the pharmacy. You do not need to supply these. This is a medical disposal device. This is a Sharps container. We recommend that you order this from either a medical supply store or through Amazon to safely dispose of your needles and Sharps, whether they're used or unused. This prevents other people from being stuck by needles after you use them and prevents transmission of bodily fluids that could be potentially infectious. In the event that you're unwilling or unable to purchase one of those devices, you are also able to purchase or use an old coffee can storage container. Anything that prevents the needles from penetrating through the container is safe and appropriate. These are the syringes you're going to receive in the shipment. I'm going to open one of them and show you what it looks like. You're going to receive multiple bags in the event that you damage the needle on accident or you are not able to use the needle that you originally pulled. Your syringe will allow you to draw up to 100 units. Most patients don't ever need to draw up this amount, so please pay attention to the markings on the side of the syringe. Your dose is going to be determined by your practitioner for the 4 weeks ahead, so please make sure that you have the doses handy before you uncap your needle. You're going to pull the bottom off of the syringe like this. This is no longer necessary after this step. We're going to place the syringe on the table and you'll return back to this in a later step. Next, we are going to uncap our vial. Once you uncap, you do not place the cap back on. It can also be discarded. Once we have the vial, take care not to touch the top of the rubber stopper with anything. I recommend that you clean the top of the rubber stopper with every single dose that you pull from your vial. Alcohol swabs can be purchased at any local pharmacy or ordered online. I don't recommend that you necessarily purchase gloves if you're going to be injecting yourself, but if a friend or family member is going to be injecting you, it is recommended that they wear gloves during the injection process. At this step, I'm going to show you how to clean the vial and draw up the medication. We're going to open our alcohol swab and take our vial and clean as such. We can place the vial on the table. I recommend that you use your dominant hand to hold the syringe. Keep the cap on during this step. You're then going to hold your vial in your non-dominant hand. Remove the needle cap, place the cap to the side. You do not need it after this step. Hold your vial, and I recommend that you flip it over like so that the liquid is at the top of the cap. Using your dominant hand, you're going to pull up exactly how many units are indicated by your practitioner for each week. In this situation, I'm going to draw up 30 units. You're going to place the needle and bury the needle until you can no longer see it all the way inside the rubber stopper. I'm going to show you right now. From this step, you can then draw up your medication. This does take some practice and some dexterity, so feel free to use your extra needles to practice this before you actually need to inject yourself. I hold the vial with my non-dominant hand, and using my dominant hand, I take my top 2 fingers like such, and I use my thumb to draw up the medication. Pull back slowly and allow the liquid to fill up the chamber till the desired dose is within the syringe. In this situation, I accidentally pulled up more than 30 units, so I'm going to slowly increase and inject back into the vial until I have exactly 30 units. Keep in mind that every time you place the needle inside the rubber stopper, the needle will dull, so try to keep this step to only one time. Once you've drawn up your intended dose, slowly and carefully remove the needle from the vial as such. At this point, you are done with your vial and you can place it on a table or a flat, firm surface. It is not recommended that you recap your needles in the medical world, but since you are injecting yourself, if you do feel more comfortable, you can place the cap back on your needle like so until you're ready to inject yourself. If a friend or family member is injecting you, please make sure that once you draw up the medication, they are able to give it to you within the next few minutes. Something to keep in mind is once this vial top is broken off or the cap is removed, you do have to use this within 45 days. That is what's recommended by our practice. I can no longer guarantee the potency of the medication after 45 days once you have first introduced a needle into this vial. You will notice on the vial there is something that says BUD. That is known as the beyond use date. If you do not uncap this vial, that is when the medication is guaranteed potent until. Once the lid is removed from the vial and you start using your medication, you must use it within 45 days in order to guarantee potency. Now I'm going to review the areas in which you can inject yourself with semaglutide. Keep in mind that this needs to be injected into subcutaneous tissue. Your inner thigh is an option for self-administration. Keep in mind this is where most of us have some subcutaneous tissue. You can do either thigh. The other area that you can choose is your abdomen. I try to do within 2 inches of the navel. Most patients have some subcutaneous tissue in this area of their abdomen that they're able to inject. Please make sure you're able to grab a handful of tissue before you inject. This is the best way to prevent any potential bruising that may occur during self-administration of semaglutide. The third and final area that I recommend for administration of semaglutide is the back of the arm. Many of our in-office patients use this area as the staff is able to easily access this area on our patients. If you have a friend or family member who is able to inject you, this might be a good option for you. When you have your dose drawn up, make sure you double check that it's the dose that's indicated. Place it on the table. Choose your area, whether it's inner thigh, abdomen, or back of the arm, and take a fresh alcohol swab and cleanse the area. I'm going to demonstrate what that would look like if I were to inject my abdomen. Find your designated area of tissue. I prefer this area within 2 inches of the navel. Make sure it's an area you can grab with 2 of your fingers, usually your pointer finger and your thumb, but it can be your whole hand. You want to open an alcohol swab and cleanse the area. Let the area dry. Do not fan it or dry it with any tissue or fabric. Once the area is dry, let go of the skin and use 2 hands to remove the cap from the needle. Double check your dosing, and in this situation, as we said, it's 30 units. I'm going to grab your tissue with your thumb and the rest of your hand, and you're going to use your dominant hand. You can hold it like this, almost like a pencil, and you're going to insert just the needle without injecting, perpendicular to your skin. Slowly administer the injection, pushing on the plunger with your pointer finger. Now you want to let go of the tissue and slowly remove the needle. Place the needle on the table or use the cap and place it back on your syringe. Take care not to stick yourself during this step. If there's any blood or any sediment at the site, you can use your alcohol swab to cleanse the area. Once you're finished injecting yourself, please place this in your sharps container. If a friend or family member is injecting you, have them place the needle directly into the sharps container and remove their gloves. Once your sharps container is mostly full, please find a sharps disposal location near you. Do not attempt to empty the sharps container into a different container, as this places you at risk of sticking yourself. When you are nearing the end of your 4-week period, please get on a call prior to the end of the 4 weeks to ensure that there are no gaps in your treatment. If you are not comfortable drawing up doses, please bring your vial into the spa and have the medical staff draw up your doses for you. We are able to draw up 4 doses at a time. Therefore, you could technically come in once a month or every 4 weeks, Get on our InBody body composition analysis tool and have the staff draw up your 4 doses for the month ahead. You can continue to return on a 4-week basis as you prefer. For patients who are unable to come to the spa on a 4-week basis, we ask that you please get on a call with us or a Doxy FaceTime so that we can discuss your 4 weeks ahead and ensure you are comfortable drawing up and administering your own doses. We look forward to hearing from you.